Okay, we say welcome to Sijme Zeilemaker, who's the COO of Immunicum. Welcome.
Thank you.
And for those who don't know you, what does Immunicum offer?
What do we offer? So Immunicum is a biotechnology company, so we're developing medicines based on the biological processes of the human. In our case, that means we are taking cells from a donor, like a blood donor, but we're using these immune cells, we activate them and we inject them into the tumor of a patient to create an immune response, like a vaccine, but then against the tumor of a patient. We've now tested that in over 100 patients actually in different types of tumors. And the bigger study there was a phase 2 study in kidney cancer, which showed the typical signs of an immunotherapy like deeper responses, so tumors being eradicated by the immune system, but also a benefit in survival, which of course is in the end the goal. So that phase 2 was very important for us, and now we're expanding into other indications and moving that really towards the market. But that in a nutshell is what we as a company do.
And you have just announced the plans for merge the operations of Immunicum with a Dutch company, DC Prime. Can you briefly explain the key arguments to why you want to take this step?
Yeah, absolutely. So we have been in touch with this company for a while because we're, let's say, colleagues in the field of cancer therapy, specifically on the space of dendritic cells. I mean, it's already the name of DC Prime, but dendritic cells is a very exciting cell type, but hasn't been used properly in the first generation of approaches that were based on vaccines from the patient's own cells. And we knew that this company was also like us, using not cells from the patient, but in their case from a cell line. And that has a lot of benefits when you try to make it more inflammatory, more tumor specific to a patient. So we've been in touch for a long time with this shared biology belief, and now was the right opportunity to do something together. And that turned into a merger discussion because they have clinical studies ongoing, they have a lot of pipeline projects that we think are very interesting, and they have in-house facilities focused on research but also manufacturing, so working on the manufacturing process. And for example, that allows us to take more control over our own manufacturing process. It has a lot of cost synergies by doing so, and the teams in a way fit quite well together because of that. They have a lot of research and in-house people on the manufacturing side. We have more clinical, regulatory, and of course the corporate people around the Nasdaq listing. So that was a very good fit. And then the last element to why doing it now and why this merger was that we were also looking to get a stronger investor base, and they have as the majority shareholder Van Herk Investments, which was to us crucial to get into the company. So they become a large shareholder, but they will also be very supportive of the future. So different elements from really the research shared goal, the complementarity in pipeline, and then last but definitely not least the investor base.
And through this merger, you will also strengthen the ownership structure by adding a well-reputed biotech investor to the company, Van Herk. Can you please explain in what way this is important for Immunicum?
Yeah, so it has been an objective for the company. We have, of course, AP4 as a Swedish institutional investor that has been very supportive to us over the years. But we wanted to add more institutional investors to our base so we can further diversify and preferably also move beyond Sweden. Really get this as a recognized European player and preferably in the long term a global leading player. So getting Van Herk on board was crucial as a first step in doing that. I think it's clear what their reputation is, and we hope that will inspire a lot of investors to join them. Their success stories like Galapagos, where they were already part of the team before they went to the US with their Nasdaq listing. Ablings, where they had a big participation before it was acquired. And of course Zealand Pharma here more locally is a good example of the type of growth stories that I believe in.
And you also announced a revised strategy priority at the end of September. How will this merger impact this? And what are the key priorities in this vision? And is it still valid after the merger?
Absolutely. It was very much part of the strategy. This was of course also ongoing while we were going through the updated strategy, and we knew that if we want to become a leading cell therapy player in the dendritic cell space, we knew that not only have Elixir and Cell as a platform, but also preferably another next generation platform, and to grow a pipeline together. So part of that pipeline was already communicated in the strategy end of September. What is important to emphasize here is that we're not just taking on another project, but because they have their in-house facilities, it will also increase the likelihood of developing Elixir and Cell. So the part of the strategy was, for example, getting to the market on an independent fashion in a small indication like sarcoma or GIST. And this is even more possible if you have your own manufacturing facilities to work on. So that was crucial to also not only have a pipeline as part of the updated strategy, but also increase the likelihood of our Elixir and Cell development and growing as a company to become again a leading player, not just based on one platform, but being the go-to company for dendritic cell therapies.
And are you expecting significant interest from new investor base through this merger? And what are your plans for further financing?
It is expected. I mean, it's a name that we know that, especially in the European space and the US, is recognized for these success stories. We know that some of the Swedish and the Scandinavian market will also recognize them, but we understand that there will be some get-to-know time to see what their intentions are. I think it's important that they've already committed to any future financing, so that's already on paper committed to us. And we're asking the EGM also to approve a mandate so we can make sure that we can, at the right time, with the right plan in place, further diversify our shareholder base and keep growing. So we are, based on that, already planning to increase our investor base and expecting more investors to follow Van der Herk and also AP4, who has committed or expressed the commitment. But of course, you can expect that we're going to need some months of integration, building a business plan together, building a development plan together. Those activities are obviously ongoing, but we will come back when we have a solid plan to present that is going beyond the current clinical studies, but really building a pipeline, building a leading company.
And what can we expect from Immunicum in the near term and long term towards 2021?
So Immunicum on its own already has an interesting year ahead of us. I think we have Iliad as a study ongoing with checkpoint inhibitors. We're now finally moving towards full enrollment of the phase 1. So 21 patients will then be enrolled, and we can follow 21 patients for the first cycles of treatment and imaging, and we will get results of those follow-up periods towards the second half of 21. And that will be important because it not only includes different indications with checkpoint inhibitors, it also includes different dosing regimens of our therapy, and that will really enable us to say, okay, this is the best combination, this is the best indication to move forward on. And of course, we already have a collaboration with Pfizer and Merck to continue following that phase 1. So that's an important ongoing study for us. And then obviously with this merger, a lot will change for our 21 outlook, with it being the EGM in December, the first event where people have to approve it. But once we have the approval in place, we can start building the pipeline together. And I think it's very positive that they already have an ongoing study. So once these companies are merged, we don't have to start new studies. We have an ongoing study that, for example, already has an interim readout at ASH in December of this year. So it's really near-term and long-term perspectives for the joint company.
Okay, thank you, Sijme, for your time, and good luck in the future.
Thank you.